Confidence in your own skin, hands down. That's how I feel.
Yeah, feeling good about your life and being able to like put yourself out there and really just like feeling good more than looking good.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Teresa McMillin and Rachel Boyka. Teresa is a physician assistant and founder of Salinas Valley Medical Aesthetics. She graduated from the University of Nebraska Medical Center in 1993 and came to California to work in family practice and emergency medicine. She developed a passion for skin and started one of the first cosmetic dermatology practices in Monterey County in 2002. She's also been an injector trainer and speaker on neurotoxins and dermal fillers. Rachel graduated from one of the top PA schools in the country in 2018, is published in the New England Journal of Medicine, has a background in general, vascular, and neurosurgery, and has been with the practice for almost 8 years. She's passionate about holistic health and specializes in regenerative treatments. So Teresa and Rachel, welcome and glad to have you here.
Glad to be here. Thank
Thank
you.
you.
Yeah, so let's dive right into it. How did each of you get interested in medicine?
Medicine in general?
Yeah, medicine in general.
Mine was kind of a journey of thought I was going to do research in physiological psychology, got a degree in biology and psychology, and started doing a leg of research in that and realized I could not stand to be in a lab in a basement doing research. And so then I was like, okay, I already got accepted to a graduate school, and I was like, what am I going to do now? I don't want to do this. And then I heard about the physician assistant program. I was thinking about MD, and my brother's a doctor. He's a neurologist in San Diego, and he said, "Don't be a doctor, Teresa. Be a PA." And that worked out really well for me. Yeah, I had a National Health Service Corps scholarship that paid for my PA school, and that got me here to California from Nebraska. I worked in an underserved area I worked with migrant care for 4 years. And
Okay.
then that just kind of dovetailed into, I always had a passion for dermatology and all of the procedures and all of the skin issues that came to the practice were kind of sent my way because I really liked it. And it just kind of just naturally, one of my girlfriends back in 2001, she had just started getting Botox. And she said, T, if you started doing Botox, people would flock to you. And she was right. So I started dermatology practice, cosmetic dermatology practice.
Got it. Okay, so that was your transition into aesthetics.
Correct.
Okay,
Yeah.
got it. And Rachel, how about yourself?
I got into medicine probably because I grew up in a very creative and kind of holistic household. I did carpentry and yoga, and so my mom was really into holistic health and stuff. And then when I started going to college, I just kind of gravitated towards the biology and chemistry classes. I was really into that, super interesting and great classes. And I also was almost going to go to medical school. I took the MCAT and everything, and one of my biology professors said that I should be a PA, and best choice I ever made. So I went to PA school, and best decision I ever made.
Got it. And then how did you make your transition into the aesthetics world?
So I started out, I actually moved to California to work at the hospital to do surgery, and I immediately found someone to do my Botox. That's probably one of the first things I did when I got here, and that's when I met Teresa. And we just kind of clicked, and I started shadowing her on my day off. And it's very inspiring to be around and learn from someone who's really passionate about what they do. So I was just kind of soaking up all the knowledge I could from her and seeing how she interacted with patients. And it was very inspiring and really got me excited to learn more about the industry. And then eventually I started working here. And the aesthetics industry is kind of the perfect combination between like me being a little bit nerdy and a little bit artistic. And I get to do a lot of research. And it's such a very quickly evolving industry that it really keeps us engaged. So.
Got it. Now I'm curious, now that with the practice, what are the most common treatments that you'd say that your patients, your clients come to you for?
I would say definitely neurotoxins. Botox and fillers are number one.
Yeah,
But
Botox and fillers for sure. I mean, everyone loves and knows Botox and fillers. I would say like microneedling and some of the collagen stimulating
yes,
procedures are getting more popular. I think the whole industry is moving towards very natural results and kind of using your own biology and healing mechanisms to get really natural long-term results. So more people are doing some of those more like natural biostimulatory procedures too.
Okay. And with that term biostimulation, what exactly is that? Is it like the injectables like Botox and fillers and all those ones, or is it a mix, or is it kind of more on the regenerative medicine side?
It's more the regenerative medicine. So a lot of it is using, it can be using calcium-based injectables, or there's something called Sculptra, but
yeah,
something that really like talks to your cells and tells them to start behaving in a certain manner. So also like microneedling, we're stimulating collagen and using PRF is very popular, and I just love PRF. I think it's so interesting, but kind of using like the platelets and how the platelets behave to keep your skin in a reparative process will just keep your skin nice and healthy and young.
yeah. And we're even doing, well, Rachel's doing most of it, injecting stem cells in as fillers, like under the eyes, things
Yeah.
like that. Doing, so people like that. It's a more natural look. That's kind of what we're all about,
Okay.
you
So
know.
with using the regenerative medicine treatments and things like fillers versus like regular fillers, what would you say is the biggest benefits for people who've never gone through the regenerative medicine side? Maybe they've done fillers, maybe they've done Botox, but what's the additional benefits of doing more of the biostimulation, more the regenerative medicine path with these?
You want me to take
Yes, I do.
that? So it definitely comes down to talking to your patient and explaining how these things work. Filler is going to add volume, and so we have to make sure the patient knows that the biostimulators and the PRF injections and things like that are not of adding volume. They're for the purpose of keeping your skin thick and healthy. So they're really nice to use in combination with
Right.
each other because we're kind of correcting the volume loss with like the deeper layers of tissue, and then the collagen stimulation and the biostimulators help keep your skin nice and thick and healthy so you get less fine lines and less laxity. So they just work in different ways.
Okay, got it. And there's all these different types of terms when it comes to regenerative medicine, PRP, PRF, exosomes, and I think now they even have like salmon sperm or things, something like that. So,
Yeah.
Oh,
what's the biggest differences between all these different methodologies? Like, why do they have different names for? It sounds like it's the exact same thing.
I feel like you should take that one.
Um, yeah.
She's the
Um,
president.
so PRP and PRF are very similar. PRF is kind of the next generation or like the more recent iteration of blood products that are used in aesthetics. And they're also used in other areas of medicine too. And they have been for so many years because they work. Um, the difference is how they're made and what like the composition. So PRP is platelet-rich plasma and PRF is platelet-rich fibrin. And the way that we make them is we draw your blood and we spin them. So PRF is spun at a higher rate. So I'm sorry, at a slower rate and a less time. So because it's spinning a little bit slower, the top portion of the blood is like the clear plasma portion, and it retains a little bit more of the heavier proteins and stuff. So that's the good stuff that we want to put back into your skin. Um, we get more of the cells and more of the growth factors and the platelets. And PRP, some of that stuff just tends to sink down to the bottom because it's spun faster and for a longer time. So PRF is just, it's a better version of PRP. We get more of the good stuff.
More of the stem cells.
Yeah.
Yeah. More.
Um, And then for like exosomes and like the PDRN and all of that, those are kind of in a different category. The exosomes are very interesting.
Yeah.
I'm very curious to find out like what is in the exosome, because the exosome is basically like a vesicle that like this cell kind of packs proteins and like ribonucleic acid and different things into like a little package basically, and like sends it out into your body. But I feel like it's hard to tell what's in that package. Like, is it going to be like good proteins or what is it going to be? So I'm definitely doing some research into like how to determine like what's good and what's not. I think they have to be like stem cell derived and not platelet derived. Um, but very interesting, and a lot of people are using them in aesthetics for
Yeah,
sure.
we haven't been using them yet, but we investigate everything
Hmm.
that we do.
Yeah, yeah,
Obviously,
for sure. Like the
Rachel does, and then she explains it to all of us.
yeah. Yeah, I definitely want to see like clinical studies and things that
Yeah,
are proven results before we start doing them on our patients. And I want to know that I'm doing the right thing and that what we're doing is
it's
proven to do
beneficial.
what we want it to do.
Okay. Now that leads me to my next question as far as the safety goes, because I know that the FDA was very against stem cell treatments for a long, long time. And it seems like now they're trying to loosen up a little bit more. More and more practices are bringing it on. More and more people are trying it. It's getting more and more popular. So, but I still feel like it's a little bit in kind of the early phases of that rollout period. So for people who've never heard of this before, how safe is it? Like, is something that they should feel really comfortable doing, or should they really be kind of aware of certain things when it comes to safety in particular?
I think you should take that one. Yeah.
PRF is very safe. I always do everything on myself and on my colleagues and on Teresa when I can get her blood.
When you
Before
can.
before I do it on anybody else, but it is very safe. There are no additives at all. So the tubes are not heparinized or there's no chemicals or anything. It is just from your blood. So you patients are not going to have any reaction. There's no like allergy associated with it. There's nothing but your own products being injected. Um, so it is very it's kind of like using the platelets to make those growth factors because the platelets are injected and they're all kind of communicating with each other and then they start making these growth factors that stimulate your collagen. So that's the same thing that happens like if you cut your arm. We're just using it in a very controlled manner to do on someone's face, but it's the same healing mechanism. So it is very safe. It's like a natural process that we're just like forcing to happen. And with any procedure, there are the risks and benefits, and side effects that can happen, but it's still very safe. Like anything, you're going to have swelling and maybe bruising and things like that, but those things are temporary and they go away and they're kind of expected to happen, but overall it is very safe to
Very,
do.
very rare to have side effects from that. I mean, unless I'm trying to think of if you're injecting it, if you are a really bad injector, because they're probably the safest thing you can inject a person with too, if you're doing
Yeah.
not microneedling.
Yeah.
So yeah, but the only other thing I can think of is if someone has really dark skin or has a history of melasma or something that could be, but we are a really good judge of skin before we do things. Sometimes we prep people's skin before procedures. We'll make them do a regimen for 6 weeks so that to avoid those side effects, if that's a person who could be have those side effects.
Got it.
Yeah.
And you're talking mostly about using the individual person's blood, but are there other situations where maybe you use somebody else's blood? Maybe like if it's somebody older and they want like a younger person's blood,
People ask us that all the time.
or something
Yeah,
like
we do
animal as well,
that.
like maybe not animal blood, but like animal products. So like, what's the main differences between all, like, is that even a thing? Like using other people's bloods or things like that? But like, is it a thing? And if it is, like, what's the differences?
Absolutely not. That would
No,
be like very unsafe and
no.
an absolute no.
We had a patient who wanted to use her son's blood.
Yeah, yeah. And so that is something that would be like pretty dangerous because
Yeah.
there would be like an allergic reaction,
I see.
because there's antigens on
And
on the blood cells, and
we
like
would have
there's
to
always a
protect
few,
people.
yeah,
That's ridiculous. Let's
yeah.
not even contemplate that.
Yeah. But it does depend on the quality of the patient's blood. So I guess the one drawback you would get is, the results are very individual depending on like the quality of the blood. So if somebody has like liver disease, which we would know beforehand, and their like platelets aren't very good, or they've been taking like aspirin for 25 years or something, um, then they might not have the optimal results, or they might just need additional treatments to get the most out of it.
Got it. Okay. And so that's the regenerative medicine side. Teresa, I'm curious on your end, like what's I would say the treatment that you really specialize a lot in?
I do cool sculpting. I mainly do cool
Mm.
sculpting now. I started with the neurotoxins. Back in 2002, there weren't even any fillers aside from collagen.
Mhm.
Way back, the Restylane was the first one approved in this country, I think 2006. And and the collagen was really bad. You had to do an antibody test before you could even get it, and it would last not very long. And so, I really grew up on the fillers here, and then I became a trainer. I had an injection trainer, and I would go and I would train other offices on injecting neurotoxins, different ones besides Botox. There's Dysport now. There's a plethora. There's a bunch of them, but
Mhm.
back then that was kind of the deal. So I would say, mine is definitely Botox, dermal fillers, and I'm doing more of the cool sculpting here.
Okay. So it sounds like you're the injection master then.
Injection.
Yeah, Teresa's like the OG of the aesthetics
Big time.
industry in
Yeah.
this area for sure. She was one of the first, and she has just so much experience using all sorts of neurotoxins and all the brands of filler. So
We've tried everything.
yeah, she's definitely a specialist in, a lot of the tried and true
Right. The
procedures.
bread and
And
butter.
yeah.
But now PRF and that's where times are changing.
Yeah, yeah. And then she's the master of body contouring and cool sculpting, and she's super busy with that. So, yeah, we make a really good team.
Okay. So I think a lot of people know about the injectables, fillers, Botox, but cool sculpting, maybe not everyone knows exactly what that is. Uh, in really simple terms, what is cool sculpting and what does it do?
It's non-invasive, permanent fat removal. It's the only FDA-approved permanent fat removal, non-invasive procedure that's available. And basically, it's cryolipolysis. So we freeze areas. We assess a patient. If it's really for those stubborn areas that you just can't get off, we get a lot of people who are in really good shape, but because of age, menopause happens, heredity. A lot of people have double chins, or they work out and they're like, why are my arms so still fat? And that's just something that they're not going to get rid of, because that's just the whole, it's not for people that are really obese. And so what we do is we apply applicators, freezes the fat, not the skin. Skin is protected. The fat gradually, the cells, about 20% of the cells during the procedure are killed. And so, it's kind of like, I liken it to like peeling the irregulars off a potato. So it's not drastic. Well, there are some pretty drastic results, but
Yeah.
I underpromise and overdeliver, and
Okay.
people are very happy with cool sculpting. Yeah.
Now, who is this for exactly? Because you mentioned like it's really going to be set for certain people and not other people. So what criteria would someone really start to seriously consider getting this treatment done?
Realistic expectations is number one. Educating your patient. We are so big on patient education. We make sure that we have time in our schedules to actually talk with our patients. And, sometimes I'll spend an hour with a cool sculpting patient just doing a consultation and making sure that we are all on the same page on our expectations. And if those people are right on, then we are then they have fabulous results.
Yeah, the ideal patient, I would also add to that,
Mhm.
Teresa,
Mhm.
is someone who kind of already has like healthy diet and exercise and lifestyle, and who just has like stubborn pockets of fat that the
Mhm.
diet and exercise are not doing anything for. Those people have really amazing results. I would not say someone who is morbidly obese it's not going to be appropriate for those people, unfortunately, but it kind of has to be accompanied with like a good lifestyle that's going to support
It's
like the weight loss and support the fat reduction.
integrated into it.
Hmm.
Yeah, for sure. It's a great procedure. I mean, myself, I acquired Cool Sculpting in 2014. It was available in the US in 2012. It's all over the world. And I had liposuction maybe 5 years prior to that in my midsection, menopause.
Mhm.
And I was okay with the results, but it was kind of like for what I went through and having to wear the band, and I could hardly, I could hardly take a walk for a few days. And then when I acquired Cool Sculpting, I was at a conference and I was going to get a tattoo removal laser, and I came back and I said, "We're going to freeze fat." And yeah, and then I did it on myself, like we always do everything on ourselves.
Of course.
And I was same areas, and I was like, if this had been available, I never would have done liposuction because, it's just for those stubborn areas and no downtime. I was working out the next day.
Wow.
Yeah.
And so I'm sure you get this question a lot. Is it painful?
No, no, it's really not. I mean, it's uncomfortable because it gets really cold. It's minus 11 degrees Celsius. The applicators get to minus 11 degrees Celsius for 35 minutes. And after the first like 5 to 6 minutes, and usually we're engaged in conversation with the patient or they just want to breathe through it, but it gets so cold. That's the discomfort. And then it goes numb.
Mm, I see.
We also have a really beautiful, comfortable, cool sculpting suite. So you just get very comfortable. You're surrounded by pillows and blankets. We have snacks, we have Netflix. So we make it very comfortable since some patients are here for several hours getting their full treatment done. But yeah, the procedure itself is just a little bit cold. And it does go numb, so it's really not that bad. And we do make the experience as comfortable as possible in our cool sculpting
Sometimes
suite.
people don't want to leave.
If I have time, I could do like a little facial on the patient or like
Yeah.
do a little massage or something while
If
they're
they're here,
getting their treatment.
if they're here for like 6 hours, and we'll order lunch.
Oh yes, that's their favorite part. They come for the cool
Someone
sculpting so
for
they can
lunch.
get lunch.
That's the first thing they ask. Where are we going to get lunch from today?
Yeah.
All you gotta do is add wine into there and you're all set.
Oh,
No one's ever
Yeah,
gonna
no,
leave.
we'll be unstoppable.
Okay, now I'm sure what are some other misconceptions that come along with this treatment? I might ask one about like pain and like who's it for, but what are some, I would say, common misconceptions you hear about this treatment, the cool sculpting in particular?
I would say, well, prior to this recent change in the pricing and the way that they package it, it would be a lot of people would get one treat. We would pay per applicator. People have to pay per applicator. And so an applicator, they have different sizes and shapes that fit on different areas of the body. And people would get one treatment and they'd be like, okay, that's okay. And then, so then, it's like, well, I did cool sculpting. It didn't work,
Mm.
because it just wasn't that impressive.
It wasn't like getting the optimal treatment that
Correct.
we're able to provide patients with
Now.
now because they changed the pricing structure which is so much more beneficial for the patient.
Yeah, all it costs. So what we can do is because we know, and the company that Allergan that owns Cool Sculpting realized that people were getting results, but they weren't doing it because they didn't want to pay for more applicators for more treatments.
Mhm.
And so now we do one price for the patient, and we can use as many applicators as we want, and we can do it up to 2, 3, sometimes 4 times in a time period of 120 days. And that way we can really get them to where they want to be. And it's fabulous. All it takes really more is my time.
Got it. Okay.
Like I'm loving it. I dig it. I get to watch all kinds of shows I never watch.
to go and do your work and be entertained at the same time.
And a great lunch.
There you go. There you go. Now, I'm curious when it comes to what you do specifically. I want to know what role do you believe artistry plays in how you approach patient care? Because when people think about medicine, I don't think artistry or creativity are words that necessarily come to mind. It's like follow this process, don't mess this up, don't kill this person. But what do you think? What role do you believe creativity and artistry plays in what you do?
Artistry is huge.
It's huge.
Yeah,
Yeah.
yeah. We are, I would say we are, half artist and, half medical provider for sure. Um, I think there is definitely an art and a lot that goes into keeping patients looking anatomically correct and proportional. And sometimes patients will come in and they really want their cheeks done and they keep wanting their cheeks done. But at some
I'm
point,
gonna lift this and then have the,
yeah,
no.
yeah. At some point, we have to learn to say no or refer out to surgery or just look at their pictures and analyze their face with them and explain like to look anatomically correct, we're gonna have to treat a different area. So one of my mottos is give the patient what they want, not what they're asking for. And
Yeah, there you go.
people want to look natural. We don't want to have people looking like a wax figurine or looking like blown up or anything.
And telling people that they came to us.
Yeah. Yeah. Yeah.
It's like, I'll do that, but don't tell anybody who did it.
Yeah. And having like really good eye for just like the attention to detail. Like if one side is higher, if one side is droopier, or if like they have a bigger side of a lip, or just like detecting those asymmetries and adjusting our treatment plan based on like that specific patient's anatomy and what they need. It's definitely not a one size fits all. Like no two patients are going to get the same treatment.
No,
Okay.
and that's what I was going to chime in about, like with us, because I mean, we're medical professionals, but we know the anatomy, but we also know what's going to be best for like patient balancing, like a chin. People don't realize how much a chin, if we can, do an injectable chin implant, how much difference that will make on their profile and even on their, jawline is very popular also. But a lot of times people don't know about that. And then we have to educate them, and they're like, wow, I never would have thought about that. I just thought I wanted these.
Yeah.
And and in a lot of trainings that are provided, professional trainings are trained like cookie cutter.
Mm,
And we don't do cookie cutter.
yeah.
We analyze the patient's face and do what we need to do, where we need to do it.
Okay. So if someone is looking for the right provider in their area, what would be the most important piece of advice you can give to them if they're trying to search or trying to find somebody, they don't know anyone? What would you advise to them?
They should be afraid of going to anyone but us.
Good answer. It's a really good answer.
Yes, well, I'll agree with that one. But I think finding a provider is kind of like finding a therapist. Sometimes you have to go in and like interview and have a consultation. And the most important thing is being comfortable with your provider and making sure that the provider answers all of your questions and just makes you feel good and comfortable about everything that you're doing. And I think that just means you have to go meet people and have a consultation with a couple of different providers sometimes.
I also think medical accreditation is
Yes.
really important. In a lot of places there's a lot of pop-up places, especially recently. And I talked to the owner of one, and she started with a doctor who was doing Botox, and I asked her, about her medical malpractice, and she looked at me like deer in the headlights, like, what is that? I
Wow.
mean, that's a critical,
Yeah.
So
Yeah.
those are the kinds of things. I think there's a lot of, I think like Rachel said, there's a lot of people that are just, you really need to feel comfortable, and you should check those things out. Their accreditation. Yeah.
Yeah, yeah.
Okay. Great advice then. Now, I'm curious, throughout your experience, I'm sure that you've had some really, really challenging cases that have come in through your door. Is there maybe one story that comes to top of mind of just a really tough case that came in and how you were able to get them a great outcome in the end?
Yeah, I have one, and it wasn't even necessarily a challenging case. It was just very interesting. I had a patient, a young man who came in, and he had an eye twitch for like persistently for like 5 years. He couldn't get anyone to treat it. He called around to a bunch of offices and everyone said that they didn't do that. And his primary care provider actually prescribed him antidepressants and his eye twitch wouldn't go away. And it was affecting his life. He didn't want to go out because this eye twitch was so annoying. I mean, can you imagine like several years of this eye twitch? And
Mhm.
then one of my patients referred him to me, and I was like, yes, definitely. Like I used like 3 units of Botox. It was very easy. I could see the eye twitch and it like changed his life. He came back 2 weeks later, after just a tiny little injection, and he was like so happy. He gave me a hug. He was like brighter. He's like, "Oh my God, I got my life back." And just like the tiniest little thing can really affect someone's confidence. And it wasn't difficult at all. And, I'm very, very comfortable treating things like that are kind of like off the beaten path of what
Sure.
what most people want. So that was very gratifying and kind of unusual that we don't see
Yeah.
like a blepharospasm every day.
Yeah.
But that was just like that's like why we get into medicine, because we want to help
I help
people
people.
and improve their life and improve their confidence and their quality of life. So that was pretty cool.
Yeah. Reminds me of that saying, tiny hinges swing big doors.
Yeah, that's
Yeah,
like the
Probably made a huge
perfect
difference.
example.
we're gonna
Huge
put that on
difference.
the back.
And I think it also speaks to the quality of what you really value because out of all the stories that I'm sure you have a lot of really memorable stories, it's the one where it's about just helping someone be their best self, just getting their life back. It's never about maximizing beauty or being really, really vain. It's not about that. It's just, hey, how can I feel like my best self? How can I just be normal, for lack of a better word? So I think people need to understand that about the aesthetic industry. It's really about how do you help people feel and look their best self.
Yeah, yeah. I have so many patients who come in and they're so self-conscious about a particular thing. A lot of people like are very self-conscious about their nose and like having a bump in their nose or having like a droopy tip in their nose. And these young women are getting ready to start college or they're getting married and they've been so self-conscious they never want to take pictures. And I'll do their nose and they like start crying. They'll
It's
like
amazing.
it's so like I start crying when I
We
see other people cry. It's just like the most wonderful feeling and it's so easy for me and it's like such a big deal for them and it's just really fulfilling to see how we can change their whole perception of their self.
we forgot to add that as one of your specialties.
Oh yeah, the
Because
nose job
the
for
first
sure.
day that she had a nose, she's like, "Hey, Teresa, I have a nose on my schedule." And I'm like, "Oh, do you want me to show you?" She go, and I'm like, I just explained it. She goes,
Mhm.
"No, I think I got it." And she did like the most beautiful non-surgical rhinoplasty, and that's her specialty. Now,
Yeah.
I don't even do them.
Yeah. I didn't intend for that to be my
You do them
thing,
so much
but
better.
that's my
You
thing.
just
Yeah.
do them so much better. I'm like, you teach one, and then she does them. She
Yeah.
does them better.
Great way of doing it.
Yes,
Yeah.
absolutely.
Yeah, I'm curious, what is the vision for Salina Valley Medical Aesthetics?
Our vision is to continue to do what we're doing. We're such a family here, and even our patients. I mean, I've been seeing some of these patients. I've been a PA since 1993, cosmetic dermatology 2002. I've been seeing some of these patients since for 21 years,
Hmm.
22 years.
Wow.
Now we're seeing the daughters and sons of,
Mhm.
okay, we have a fair amount of men in our practice too. And yeah, so I just think that because sometimes, people are not a good fit for our practice, maybe, and we like to keep it where we are a family. We know the names of our patients. Well, our office manager knows everybody when they walk in the door, and that's really special. People feel really special here. Like Rachel saying, people get very self-conscious about some of their aging issues or whatever issues, the
Mhm.
blepharospasm. And it's a place of vulnerability. And so you really have to speak to that and understand that that's where a lot of them are coming from. And it's just so gratifying to help people get their confidence back.
It's a great vision.
Yeah.
Now, I have one last question for you, but before I ask it, I do want to point people to your website at svmedaesthetics.com. Now, last question is, what does beauty mean to you?
Confidence. Confidence in your own skin. Hands down. That's how I feel.
Yeah, feeling good about your life and being able to like put yourself out there and really just like feeling good more than looking good.
Awesome. Well, there you have it. Teresa and Rachel sharing their expertise. Now, where can people contact you and your practice?
We're at Salinas Valley Medical Aesthetics. Our phone number is 831-475-9175. And we also have our website, as you mentioned, svmedesthetics.com. We have an Instagram, which Rachel does amazingly funny things on.
Nobody look at our Instagram.
It's very entertaining. And anywhere else? We have a YouTube channel. I think we're gonna,
Yeah, you can call our office with any questions.
Right.
You can book an appointment or a consultation online.
Oh, yeah.
And of course, Lou's, our wonderful office manager, is always here to help, as are me and Teresa. So yeah, and we're located right in the kind of in the heart of Old Town Salinas, California. So it's a really cute little area.
Yeah, we bought a Victorian and redid it. It's beautiful.
Oh, nice.
Yeah, it's really nice. And we have another receptionist, and then we have two nurses on staff too.
Nice.
And they're great.
Awesome. This is great. It was a lot of fun talking with you. Thank you for coming on. Thank you for sharing your knowledge and your wisdom.
Thank you so much, Dan.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.